Hi, I'm Dr. Darshna. I'm the consultant gynecologist obstetrician at Shalby Hospitals Mohali. So today we will talk about a very common topic, which is basic care during pregnancy. So what you must expect during your pregnancy and your postpartum care, everything I will be mentioning. But before that, nowadays it is very important to undergo something called as the preconceptional counselling. So what is preconceptional counselling? So generally for a woman, it is essential to undergo a basic health checkup before embarking onto a pregnancy. This is to ensure that you are not having any other underlying medical condition, to undergo some of the screening tests. So, for example, if you have any underlying conditions like that of any thyroid disorder or diabetes or hypertension. So what all the basic investigations that you must undergo and what all medications you should be on. So it is very essential to undergo a preconception counselling. Very basic test like that of rubella antibodies will be done so as to ensure that you have adequate antibodies in your body to for any rubella infection in the future. And some of the common viral infections will be also screened, and you will be given some folic acid tablets. So these folic acid tablets are quite essential to take during a pregnancy. This is to ensure that your baby is not affected with what we call as neural tube defects. Now these are defects which are associated with the neurological development of a baby or the development of spine. So common disorders like spina bifida or anencephaly, the baby can be affected with if you are not taking the folic acid tablets regularly during your preconception period. You must take them about 3 months prior to conception. So after you have missed your period, you must undergo a test which is called as a urine pregnancy test, and if it is positive, you must report to a doctor so that you can undergo a few tests to confirm your pregnancy. So I will talk about the various ultrasounds and the essential blood tests that you must undergo and the number of visits that you have to undertake during your pregnancy, entire duration of the pregnancy. So pregnancy, the entire duration is a total of 40 weeks. We divide it into 3 groups. The first 12 weeks is called as the first trimester. The second is called the second trimester from 12 weeks onwards till 28 weeks. And the third trimester is 28 up till 40 weeks. So after you've missed your period on your first visit, you will be advised to come for a scan later during after the 6th week until the 9th week. This is to confirm your baby has developed the heartbeat and everything is under normal condition. So what are the symptoms that you can expect during your first trimester? This is like having excessive nausea, vomiting, sometimes sensation of vomiting, sometimes retching, and sometimes increase in the frequency of passing urine. So these are some of the common symptoms that you can have during the first trimester. So after your first trimester is over, there's an important visit that you must undergo. This is at 12 weeks. Now this is to confirm that your baby should not have any genetic chromosomal abnormalities. So what are we looking for exactly during that scan, or what are we looking for? So this is to detect any abnormalities. We have commonly heard about a syndrome which is called as Down syndrome. Now there are other trisomies which are like Patau's and Edwards syndrome. Now this is important to screen for a baby for these syndromes so that your baby is not affected with such a condition and you can be managed at the right time. So it is important to undergo the level 1 scan and also after that a blood test which is called as the double marker or the dual marker. So after everything is okay, then we are good to go ahead with the pregnancy. Again, a next visit at 16 weeks of your gestation just to ensure that you are doing fine with your pregnancy. By that time, you will have some symptoms of mood changes, like you may feel low, you may feel a bloating and other symptoms like pain. So if you have any other symptoms, you can report to your doctor. And after 16 weeks, again there is an important scan that we undergo at 18 to 20 weeks. That is called as the level 2 scan. So by 18 to 20 weeks of pregnancy, your baby has formed already. the important structures are well developed. By that time, if we have to detect any cardiovascular problems or any problems with the kidney, heart, bones, so any abnormality will be picked up. If there is, if everything is normal, then again we are good to go ahead with the pregnancy. So after 20 weeks of pregnancy, again there will be some physiological symptoms which you will think that, oh my god, this is abnormal and I'm not able to cope up. So these are very physiological symptoms that may be quite bothering for you, but you can always visit your doctor in the meanwhile if you have any problems. Again, the next important step is 24 weeks, where we have to undergo a OGTT test, which is called as the glucose tolerance test. Now in India, it is GDM, what we call as a gestational diabetes, is quite common. The incidence is about 25%, about 15 to 25%. Every woman should undergo a sugar test with Glucon-D so as to rule out any gestational diabetes, because it can affect your pregnancy later. It is very important to undergo that test during a 24 weeks. Again, after 4 weeks, you will be invited for a visit which is at 28 weeks. By that time, your baby will grow again, put on some weight, and we will be able to assess if your baby is growing adequately along with the pregnancy. So we'll be able to judge if the baby is growing not enough or any problems. So if we think that the baby is not growing up appropriately, we might need you to undergo another scan or another ultrasound at 28 weeks to see if the weight is correct and see if the fluid around the baby is good enough. So after 28 weeks, then again, if everything is normal, we will call you at about 32 weeks. And 30 to 32 weeks, anytime you feel abnormal, you can always come back to us. And we prefer to have 2 weekly visits after 28 weeks of your pregnancy up till the 34 weeks or 36 weeks. Again, at 32 weeks, you have to undergo some of the blood tests, again repeat, like that of hemoglobin and thyroid serum TSH, and some of the important tests like urine routine. After 32 weeks of pregnancy, then you are into your advanced stage of pregnancy. So what we will ensure at that time is you have a screen again of what is your expected date of delivery and what kind of care you will require and how your labor will look like. So usually a normal pregnancy, there is spontaneous onset of the labor pains from 37 weeks onwards. Sometimes there can be preterm labor, the pains can come beforehand. So it all depends how your pregnancy goes on after that. So normally we prefer a normal delivery, which is a natural process. We again ask you to come back at 34 and 36 weeks to ensure that your baby is kicking well and you are doing well. And also we advise antenatal exercise program. Here what we tell you is to do some squatting exercises, some duck walking, some of the pelvic exercises, so that your pelvis relaxes and it helps in the normal delivery process. So we will wait until your normal labor pains start, and you can come anytime in the emergency room and we can admit you. And if we have any other medical condition or any other indication, you might also need a cesarean section. That all depends on every patient. So I have talked about a basic antenatal care right from preconception until the delivery process. Again, in the postpartum, it is very important to know some of the facts that in the postpartum period, it is important to undergo exclusive breastfeeding for the baby. You can have somewhat mood changes or postpartum depression, postpartum blues, what we call as. This is a kind of low mood, a state of low mood and crying and very low interest, taking less interest in the activities. So it's very, very common. It is about found in every 8 of every 10 women who have delivered. So it is important to be aware that it is normal to feel like that. Then your postpartum visit will be at 6 weeks post delivery, and you will be checked for your health again. So I have talked to you about the preconception, the pregnancy and the postpartum period. So at Shalby Hospital, we are providing excellent care for all the pregnant females and for everyone who is trying to conceive. We also have good fertility options, management options for you, suited to your needs. Whatever profile everyone has, we will work on that, and we will look forward for a pregnancy. So you can avail our services for pregnancy care, for any fertility treatment. Also in the gynecological treatment, we have a list of facilities like that of pap smear, endometrial biopsy, and other operative procedures like laparoscopy, hysteroscopy, and other surgeries. You can contact us on the details which will be given to you. So thank you for your time.